Hello everyone, I am Dr. Dikshit Bangera, Resident Medical Officer in SL Raheja. So we have here Dr. Soni Mehta, who is a consulting urologist and andrologist practicing in central Mumbai. As a urologist, his areas of interest are kidney, ureteric and bladder stones, prostatic diseases, both benign and malignant, male and female urinary incontinence, reconstructive urology, pediatric urology, and all cancers related to urological tract. So, hi sir, we have some set of questions for you. So,
Good
what
morning.
is good morning, sir? Good morning.
Yes.
What is prostate enlargement, sir?
So it's a fantastic topic concerning most of the men. The reason I chose this topic is because it affects a lot of men. Uh, like female women, they do suffer in silence many a times, and in fact, when they come to our OPDs, what happens is they have suffered a lot. So what happens is basically there is a prostate gland which is situated right beneath the urinary bladder. The thing about prostate gland, why is it important, is because it is situated right at the bladder neck. So what happens is, as and when this gland enlarges in size, it tries to narrow down the passage, the outlet of the urinary bladder, and that makes it difficult for a patient to pass the urine out. Now, as and when the passage becomes difficult, there are multiple signs and symptoms. Yes, Dikshit.
Yes. So, what are the signs and symptoms, sir?
Fair. So now, first and foremost, his urine flow will become slow. If the urine flow is slow, he will not be able to empty the bladder correctly. If the bladder is not getting emptied correctly, some amount of urine will stay back. The urine that stays back keeps on giving him the urge to pass urine again and again, thereby increasing his frequency. So on and so forth, the problem will increase over a few months. Thereafter, he will start getting the urgency in the night as well, and the bladder is going to become a little bit hyper, and he may have to get up multiple times in the night, which is commonly known as nocturia. So these are the common things, common signs of prostate enlargement that a patient faces. There are uncommon signs as well related to infection, stone formation, which all happens later. Now, eventually, what happens is the bladder becomes very weak, trying to push the urine out, and thereafter there are consequences to it. Yes, Dikshit.
How does it affect the health, sir?
Fair. So locally and otherwise, locally, if the prostate is enlarged, like I said, that it is obstructive to the urinary flow. So whenever there is any obstruction to the urinary flow, the bladder tries to overcome the obstruction. The bladder tries to push the urine out. It tries to empty itself out. In that situation, what happens is the bladder is doing extra work. The patient may not experience straining. He may just experience that my flow is slow. I'm taking a longer duration of time, but somehow it is empty, getting emptied. So number one, that voiding time increases. The amount of time you spend in the washroom to pass the urine out and empty it fully, completely increases. Followed by which, eventually, the bladder, in spite of working very hard, is not able to empty it. So some amount of urine stays back. So you may get a sensation even after passing urine that something is staying back. You may need to pass urine again after half an hour, 1 hour, again and again. That is known as double voiding. Thereafter, when the bladder eventually becomes a little bit weaker with chronic straining, we start using our abdominal muscles to put it out. That is where the patient says that, yes, I have to actively push the urine out. So, of course, the bladder muscle is in use. Along with that, the abdominal muscles is working overtime as well. So that is a sign when the bladder has already become a little bit weaker, followed by which it has to push the urine harder. Now, this is what happens locally. Just behind the bladder is something called as kidneys. The pressure from the urinary bladder starts affecting the kidneys, and thereby the kidney function may also start deteriorating eventually. Now, this is the local effects that patient faces. The general effects that a patient faces, of course, if he is getting up multiple times in the night, he is going to be tired throughout the day, and otherwise it is going to affect his output. It is going to affect his mood. Multiple things that can be affected. So that's why it starts with a minor thing, with blockage of bladder, and it can affect the general health as well. Yes, Dikshit.
So, what are the treatment options for it, sir?
Fair. So whenever a patient comes to OPD with prostate enlargement, first and foremost, we assess as to where does he stand with respect to his obstruction. So if the prostate obstruction is profound, for example, retention of urine, we might need to put a catheter and treat it accordingly based on the bladder situation or the state of the bladder then and there. If he comes with mild symptoms, obviously we start with medical treatment. With medical treatment, we observe some medications, some tablets that he's supposed to take it regularly with literally minimum side effects. He has to take it for a month. We observe what is the improvement, subjective improvement, objective improvement with uroflowmetry or urodynamic study, and see whether we can maintain him on medical treatment. So if the medical treatment is working fine, nothing like it. We will continue for X number of years till the time the patient does not go into complications. Now, if the patient is in complete blockage on catheter, and if the bladder is working fine, we have multiple options starting from the age-old, tried and tested, gold standard transurethral resection of prostate, wherein we put a camera through the penis and resect the extra glands. It is now we have bipolar TURP for extremely large glands, more than 80 grams, and of course we have HOLEP or TULEP, that is laser treatment of the prostate that we generally do. Yes, Dikshit.
So surgery is required. When is the surgery required exactly, sir?
When the medical treatment fails, or if the patient is deteriorating even on being on medical treatment. By deterioration, I mean the bladder getting weaker, the creatinine shooting up, secondary back pressure changes onto the bladder, and there are some patients who may not tolerate the tablets as well. In these situations, 100% we require a surgical treatment and get rid of it completely.
What are the contemporary surgical options, sir?
Surgical options, like I said, monopolar transurethral resection of prostate, bipolar transurethral resection of prostate, laser surgeries, HOLEP and THULEP that we do. We are coming up with a new option called as RASM. We are going to introduce shortly at Fortis Mind, wherein we inject water vapor inside the prostate, and that leads to dying down of a part of a prostatic tissue, thereby reducing its size and thereby making it easy and simpler. There are many patients with cardiac complications who are not fit for anesthesia. For them, RASM is a blessing. There are other options which are there in theory, Urolift and other things like that. But as of now, they are not reached gold standard wherein we can recommend them to each and every patient. So we have to customize as per the patient. For each and every patient, we have to customize the treatment.
Yes, sir. So when to seek help, sir?
Whenever you feel you have urinary obstruction, whenever you feel you are not able to empty it correctly, whenever you feel you're getting up multiple times, or multiple times I mean more than once, and it is a prolonged thing that you are facing, whenever you feel that your urination is not completely okay, definitely you should approach. That is number one. Number two, you should, as a routine examination for post the age of 55, we recommend a urological consultation once, so that at times prostate being a slowly growing enlargement, it may reach a stage wherein things will be irreversible. So it's a good idea after the age of 55 to visit a local urologist once and evaluate and check if everything is fine.
Okay, sir. Thanks so much for your input, and I think so this will help people in Facebook
Most
Live.
welcome. Most
Yeah.
welcome.
Thank
Most
you, sir.
welcome. Thank you. Thank you.